Cellulite's a little tough. We use a combination of laser resurfacing after. You can also use a Selfina, which is a small little pneumatic drill the company MERS makes. And then I can fill in some of the deep dimples with it. It won't get rid of it 100%, but with a combination of lasers and fat, it should get a lot better. It's two things. It's how I extract the fat using a 3mm and sometimes 4mm cannula, and then how we put it back in a no-touch technique. And then it's how you deal with yourself at home. There's only so much I can do. Once you're gone here, I've done my job. Once I follow up with you, I'm doing my job. It is your job to follow strict instructions. We can't tell you that the fat's gonna be 100%. There's no one in the world that can tell you that. I can tell you that we see 70 to 80% take in most people when they follow strict instructions. Non-smoking, get your diabetes under control, don't sit on your butt, don't drive early. These are just the things that you can do to make your absorption take greater. Oh, a BBL scarring, they're really tiny. Of course, most of the people in South Florida and South Texas are a little dark. So you're gonna have some post-surgical hyperpigmentation, means it's gonna get dark. Usually that goes away in a year and it starts to get lighty. And if it doesn't, there's creams or lasers that we can lighten it. Absolutely. I know some women in their 60s who are healthier than some people in their 20s. What is your goal though? Are you getting a BBL for yourself or you're getting it for someone else? First of all, you have to understand that you're the one undergoing the procedure. Do this for yourself. Don't do this to be pressured by someone else. So yes, someone in their 40s that is healthy, and we're gonna judge that, I'll judge it personally, then you should have no problems. So BBLs are like lips. You know, if people want big lips and they started with small lips, you're gonna have to have 2 or 3 syringes. If you want a larger butt, you're gonna have to have 2 or 3 rounds of BBL. We don't know how much it's going to take, and we can't follow you the whole time for that 2 weeks to see, did you sit on it? Did you not sit on it? Which way did you lie? What happened? Did you have trauma? So 2 or 3 rounds could be in your book. The issue for us is we can't monitor you. And having 2 or 3 rounds of fat grafting is kind of normal these days. Sexual encounters after surgery in general. It depends on the surgery. If it's just liposuction, a week to maybe 10 days. If it's a BBL, your butt is part of the sexual process. So you probably want to wait 2 to 3 weeks, at least until we kind of clear you. So minimum of 2 weeks, better at 3, the best at 4. I know it's going to be tough for some, but you only get doing this once, and doing it right once is better than having to redo it because we made an error at home.